Good morning, everybody, and welcome to our special webinar today. We're introducing you all to a new member benefit that we have with ASA for members only. For many years, we've heard from our members that affordable healthcare program would be very attractive to them. And we have searched far and wide for many years to find the best group, we think, for offering the healthcare benefit to you all. So I would like to, without further ado, I'll let them introduce themselves and their background, but I'd like to welcome Stephen Chapkin and Harris May to our webinar this morning.
Thank you, Julie. Appreciate that. Hi, everyone. Good morning. I'm Stephen Chapkin. I appreciate the time that you put aside to view this program. Um, I'm here with Harris May, who's my colleague, and we'll talk about part of the program. My background is strictly in health insurance. 45 years in the industry, was on the payer side with Cigna and Aetna for most of my career in senior leadership roles. And after leaving the corporate world, I started a company called Simple Health, and the company is focused on providing health benefits to associations, specifically just like the one that you're in today, and the benefits that we provide try to mirror the benefits that are offered to large Fortune 500 companies. We know that the companies like yourselves, small businesses, are sometimes disenfranchised in a way in terms of getting programs and rates. So we wanted to try to correct that. And that's what this health program is about. So, can everybody see my screen? Am I sharing my screen here? Yeah, I think so. So, without further ado, let's delve into this program and talk about the ASA Health Benefit Program, which is exclusively for ASA members. A little bit about the agenda. We're going to talk about our benefit administration. I'll go into the different PPO and EPO and HSA compatible plans, um, the monthly premiums that are available or published for you to see, and how we get to those premiums for you. And then we'll show you how to um, get a quote or inquire about a proposal if you so desire. And then we'll open it up for questions and answers. So to start, the plan administrators have 25 years experience in this form of business. They have over 1,500 businesses insured. These are small businesses, just like yours, and over 150,000 employees are covered under their program. The plans that we're going to show you today are fully funded plans. And what that means to you is that there are RISA compliant plans that are similar to those that you'd find in a Blue Cross or Aetna or Cigna program. You pay a premium, you get your benefits, and at the end of the year, if you choose to walk away for whatever reason, there's no terminal liability. Plans are guarantee issued. The rates that you see will be the rates that you will get. There's no underwriting involved in these plans. And all plans are ACA compatible, compliant rather, meaning that they comply with the Affordable Care Act's program around preventive care. So vaccinations, mammograms, colonoscopies, and well woman care, physical annual physicals are all covered at no cost. We give you a choice of two PPO networks. Clarative, formerly Multiplan, is a PPO, one of the largest PPOs in the country, actually, with over 1 million practitioners and over 4,800 acute care facilities, hospitals, and outpatient surgical centers. First Health is another PPO network and is a subsidiary of Aetna. Has over 1 million providers as well, over 5,900 hospitals and other ancillary locations. The the PPO networks will be regionally more available to you wherever you are. So I would recommend that you use the search function that will provide to you to see which PPO network meets your needs better than another. Let's talk about the plan design. So there are a number of different plans available to you, and I'm going to go through just a brief overview of them. The PPO plans are traditional PPOs. You have a network of doctors and hospitals, as I mentioned, a choice of either the um, First Health or Clarative PPO network. And this particular plan right here is a $3,500 deductible PPO. It has first dollar coverage for telemedicine, no cost, family physician visits, a $40 copay, specialist a $75 copay, and urgent care is a $90 copay. All other services, inpatient and outpatient hospitalizations and surgeries and emergency rooms are subject to deductible and 20% coinsurance up to your out-of-pocket maximum. The next plan is a copay 4,500 plan. Same benefits, except that it has a 30% coinsurance after deductible. Otherwise, the first dollar benefits are identical. Zero cost for telemedicine, $40 copay for family physicians, and $75 copay for specialists, $90 copay for urgent care. Each of these plans comes with a prescription drug benefit with no additional deductible. Generics are $20 copay. Preferred brand drugs are $65 copay. Non-preferred brands are $95 copay. And a benefit that many companies are not offering today, specialty drugs. Limited number of specialty drugs are available at a $200 copay. If you're looking for an EPO, which is a lower cost version of a PPO, an EPO is the identical network that's offered that I mentioned before, except there are no out-of-network benefits. You find it similar to an HMO, except with an HMO you only have access to a local network. With an EPO, you have access to a national network, and there is no gatekeeper. There's no requirement for a referral from a primary care doctor to a specialist. You can go directly to a specialist in this. As you can see here, the annual deductible is $1,000, much lower, but every benefit is available after deductible. This plan only offers a generic drugs at a $0 copay. Um, and but brand name drugs can be had at a discount through a patient advocacy program that they have. We also offer HSA compatible plans. A health savings account is something that some people really love. And these plans are unique in that the administrator will contribute $25 per month to each person that enrolls in an HSA compatible plan. So we have this plan here, the $3,500 copay plan. Everything is after deductible, and after deductible, it's 30% coinsurance for this program. Otherwise, the benefits are identical to those that I mentioned before. Then we have an $8,300 copay plan, same benefits with an $8,300 deductible. And then we have an EPO that offers an HSA benefit. It's a $1,750 deductible EPO that offers significant benefits. So after deductible, it's a $50 copay for family physician, $50 copay for specialist, $50 copay for urgent care, and all the other benefits like inpatient hospital and outpatient surgery have copays as well. Again, this plan only offers generic drugs, but at no cost. And they offer a patient assistance program to help you obtain brand name prescription drugs if needed at a discount. The last program that we offer are what we call visit limit plans, limited benefit plans. These are, again, PPO style plans, but they get access to either one of those networks that I mentioned earlier. But they have limits on the number of visits to a physician or an urgent care center, the number of times you can go into a hospital for a particular procedure. So in this case, inpatient services are limited to 2 ICU encounters each year and 2 non-ICU encounters per year at $1,000 per admission. There's no limitation on the number of days, just the number of encounters. You're limited to 3 surgeries per year, 2 emergency room visits for accidents, and 2 emergency room visits that are sickness related per year, and so on and so forth. But this is a very low cost plan. If somebody's looking for basic benefits, young, healthy person just wants to have something that is that covers them for the occasional um, unplanned illness or injury, this might be a plan that works for them. Same plan in a $1,750 deductible format. This is compatible with an HSA, and again, the administrator will contribute $25 per month to the health savings account. So I mentioned the rates, and this is where this program is unique. These rates are compiled through a trust in Georgia, which allows us to offer the same exact rate everywhere in the United States. And they have these rates are available for groups down to 1 employee. So the base rate, which I'll show you in a minute, is available to groups with 5 or more eligible employees with a minimum of 3 enrolled. If you have 2 to 4 eligible employees and a minimum of 2 enrolled, the base rate is increased by 10%. And if you only have 1 eligible employee, the base rate is increased by 15%. And what that would look like is this. This is an example of the $4,500 copay PPO. As you can see, the base rate is $649.80 for an employee, $714.78 if you have 2 to 4 employees enrolled, and $747.27 if you have only 1 employee enrolled. It's open to W-2 and 1099 employees as well. This is what a proposal would look like. If you have a current plan, we'll put your current plan in there with all the benefits that you have and your current rates, and I will try to find the most compatible plans of the 8 that we offer, compatible with your plan, and put them side by side along with their rates. And if there's a rate reduction, we'll show you the percentage of the reduction so that you can do a apples to apples comparison. Because the rates are published, and it's a very simple process to just let me know how many. I don't need to know the ages of your employees or the sex of your employees or the names of dependents. I just need to know how many single employees there are, how many employee and spouse, how many employee with children, and how many family employees so that I can plug that in and make an apples to apples comparison. Very simple for you to do. So I'm going to turn this over to Harris May now to discuss the voluntary benefits, which are programs that complement and increase the benefit of the medical benefits. And these are voluntary benefits that don't require an employer contribution, but certainly would work with an employer contribution in terms of being of value to hiring quality employees. So I'm going to turn this over to Harris and take it away.
Good morning. Thank you so much for the introduction, Stephen. I provide ASA members with voluntary benefits from Colonial Life and its parent unit. Colonial Life and its parent Unum are the largest provider of voluntary benefits, second largest provider of voluntary benefits in the industry, and the largest enrollment firm. Now, the voluntary benefits that you see on this page, you can be offered through payroll deductions. And as Stephen said, it's no cost to your firm. You can, of course, provide some assistance, and many people do, but it's not required for these benefits. And as Stephen said, these benefits complement Stephen's plans. In other words, they provide benefits that the core health care do not provide, like life insurance, accident insurance, and dental insurance. The benefits are paid in cash, so you could use them to pay for the deductibles for the major medical. However, you can purchase these things independent of a core plan. And sometimes you can, if you want, you can purchase them in anticipation of buying a core plan in the future. Each plan addresses a real or perceived risk that an employee may want to insure against. And they pay cash benefits to the employee when a listed occurrence occurs. So, for example, if they broke a bone, had to go to the hospital, had to go to emergency room, cash benefits would be paid to them that will allow them to satisfy those bills. To fully understand what these plans mean, I'd like to personalize it for a second. And just take a look at all the different plans. I don't have to read them to you. But if you look at those plans, you can ask yourself, do you have a history of cancer in your family? You have a history of strokes? Do you have an active lifestyle like my family that loved to ski and snowboard? And so breaking a bone or two or getting knocked out is not out of the picture. If that's the case for you, then there is a plan that will help you when these incidents occurs. These are called indemnity plans because they will provide your family with cash benefits when an incident occurs and help you when you're out of work. The plans are really not very expensive. For example, you can if you're in Texas and you want to have an accident plan, it's only about $4.81 per week. If you don't have any life insurance, or your employee does not have any life insurance and is afraid that burial expenses will be be onerous for you, then a life insurance policy with the guaranteed issuance can cost anywhere, a 35-year-old person as low as $29 a month, and a 45-year-old person anywhere from $46 a month. So if you take a look at these plans and you say, well, just like to have some idea of how this would work for you, you can always just contact me. I think our contact information is listed on the screen somewhere. And you can ask for a couple quotes. I can give them to you. And you can decide if this is something that you want for yourself or you want to provide to your employees.
All right, thank you very much, Harris. We're going to get to the contact information in a minute, but I wanted you to know how to request a quote or inquire about any of the plans. Very simple to do. All you have to do is to go onto the ASA homepage, and you'll see banner ads for our program. Just click Explore Plans. This is a different banner ad. You'll come to this page that will take you to this website, ASA Health Benefit Options website, and click on Contact Us. That will open up an inquiry form, and you can request an inquire about a program either for voluntary benefits, for medical benefits, or for both. And both Harris and I will get that information and respond to you quickly. Before I get to Q&A, Just a couple of final notes. First of all, I want to really emphasize the fact that these are concierge, we provide a concierge service. Um, the ASA, if you will, is a big fish in a small pond. If you go with one of the marquee carriers, Blue Cross Blue Shield, you're not going to get the type of service that we'll provide to you. And I'm talking about not only providing you with a rapid proposal, but after sale service. If you have a problem and people invariably have issues with claims or finding a provider, we're there for you. We're small business focus. Very important to know that we really only offer programs that address the needs of folks like yourselves.
Let me
Uh,
add something to that, Stephen. Since Colonial is the largest enrollment firm in the country, if you have 5 or more employees, we can actually, in most cases, have a enrollment person come to your site and sit down with each of your employees and explain the voluntary benefits in detail.
yeah, that's a good point, Harris. Dual option plans. You can offer more than one plan if you have 10 or more enrolled employees. Um, these plans, I can't emphasize this enough. They're only open to active ASA members and dependents. You cannot get these plans in the open market or these rates. And enrollment forms need to be received by the 15th of any month prior to your effective date. So these aren't calendar year plans. They'll run from the date that you enroll. So if you have a group that has an effective date of May 1st, this will run till April 30th of the next year, and so on and so forth. With that, these are the infamous contact numbers and names for each of us. And I'm going to open this up. If you have any questions, we're happy to answer them now.
Thank you, guys. Thanks, Stephen and Harris. Okay, we do have one.
In the chat, I see.
How can I get a printout of all the plans and prices with explanation?
Very simple. Send me an email. Send an email to me at the address you see there, Stephen at myasahealthcare.org, and I will send it to you as soon as I receive it. It's very simple.
The same thing would be for the voluntary benefits.
One other thing that I wanted to mention is because these plans um, are written out of a trust in Georgia, and they have the same rate in all 50 states, we're not going to be a panacea for everyone. I want to just qualify everything. The rates are very competitive, but they may be 30% less in the Northeast and 10% less in other parts of the country. The other thing that I'd like to mention is that you should really take a look at both PPO networks to make sure that the one that you choose is the one that has the most robust provider access in your particular area.
Okay.
Anybody else? I see one other in the chat box.
Yeah, if we sign and an individual has a problem with a claim, will a robot be the only thing available for an answer?
No. Only live people based in the US will respond. You'll be assigned an account manager, plus you'll have me as a backup to that. So it's no, the answer. And I feel your pain when you talk about things like that because I've gone through it myself.
I truly appreciate that question because I almost threw my $1,000 cell phone or whatever it'd be to replace it uh, through the window the other day. So thank you for that question.
Yeah. I see another one in there.
Nope, I just a bravo for
Oh,
that.
okay. Okay, good.
We are, we're thrilled to offer this, and that was actually one of the considerations in our board's decision to go with this group was, it's not housed, the call center's not housed outside the US, and you're not sure what time zone you're talking to. And and all of that. So
Yeah.
I understand why people have to do that and why companies, but it sure is tough.
Listen, having been, as I mentioned earlier, a senior member of large national health insurance companies for many years, I know the politics and the processes that they go through to save money on their end. And
Yeah.
one of them is outsourcing to other countries uh, and using AI and other means that will not only save them money in terms of the cost of doing something by with that and somebody out of the country. It also allows them to eliminate lots of employees, and I don't really appreciate that, given the fact that we have an economic crisis going on in the country today. So,
Mhm. Very true. All righty. Any more questions from anyone?
all right. Well, thank you very much for your time. We really appreciate it, and I hope that we get an opportunity to show you um, what we can do in terms of providing you with quality benefits at a very affordable price.
Thank you guys. And we'll follow up with everybody with the contact information afterwards too. And a recording of this webinar so that you can review it if you need to.
Great.
So thanks, Stephen, and thanks, Harris, and we'll talk to you soon.
Okay. Bye-bye.
Thank you all for being on.